exciting ASCO 2019 for kidney cancer. Many important studies, even though some were negative, were presented. So one study of particular is adjuvant from the ECOG with Dr. Len Appelman looking at adjuvant VEGF TKI pazopanib. Last ASCO we saw sorafenib didn't have an effect. Adjuvant, I would say, maybe that's not the right term. Patient with M1 and ED that has resected metastases free of disease. And actually with sorafenib last year from the Italian group, we didn't see a major difference of sorafenib versus no sorafenib, influence, progression, survival, same thing. And it wasn't a surprise with Dr. Appelman's study. A very well designed study. There was no difference if you put patient on pazopanib and they have M1 and ED disease. Another interesting story follows on the plenary of Dr. Mejean from last year. Dr. Mejean had a plenary about cytoreductive nephrectomy and RCC and showed that really it's not for everyone. And here what him and his French colleagues did is looked at the IMDC risk group, and we know how this group in a way, as well the MSKC risk group, how they change how we think about metastatic renal cell carcinoma. And actually there was differences. Maybe cytoreductive nephrectomy could be attempted in some patients, especially if they have few risk group 1 IMDC risk group. This is important and actually will play a role in practice. So, and will lead to hopefully even better and better multidisciplinary and integrated practice. Another interesting actually thing I saw at ASCO, now this is a non-exhaustive list, I can't go through everything, was the focus this year in metastatic disease on the difficult to treat histologies. More rare, difficult to treat, that's the non-clear cell, the sarcomatoid. There is some beautiful work from Keynote 426, from some retrospective studies, as well from nivolumab and ipilimumab combination, the Checkmate 214, as well actually from a phase 2 trial of atezolizumab and bevacizumab in non-clear cell RCC that showed patients do respond to checkpoint blockers. And what is refreshing is there was actually a grouped abstract around sarcomatoid histology. I mean, these can happen with every renal cell cancer, clear cell, papillary, other, but more and more data is coming, whether from trial or from large data sets, that patients seem to have better outcome with checkpoint inhibitors. And Dr. Bakuni, Dr. McDermott, and Rini, and others presented that data. And quite interesting, because these patients do not respond well to chemotherapy, do not respond well to target therapy, and there is some immune signature here and some biologic differences. And I look forward actually to continuing with this path, because these tumor, the sarcomatoid containing tumor, are quite aggressive. So having a consensus on what to treat them is important. And